Is it true you can die from popping a zit on your face? Let's discuss. I'm sure you've come across at this point posts warning that you should never, ever, ever pop a pimple in the triangle of death or the danger triangle of your face due to concerns that the bacteria will travel from the bloodstream up into your brain and cause a serious life-threatening brain infection. While these posts come across fear-mongering, hyperbolic, over the top, I have to say there is truth to what they're saying. First of all, what is the triangle of death? Sounds a bit like the Bermuda Triangle, which, as a side note, is it just me? People have stopped talking about the Bermuda Triangle. Let me know if you have any insight as to why that might be. The triangle of death represents the area from the corners of your mouth up to the bridge of your nose. And due to the nature of the way the veins are oriented around your nose, it's an area where you have to be really, really, really careful if you get an infection, because yes, there is a definite risk that those veins, because of the way they're oriented, can transmit bacteria retrograde up into the brain and cause serious brain infections, such as meningitis or brain abscesses or something called cavernous sinus thrombosis. The cavernous sinus is just a space at the base of your skull where different important structures like different nerves and blood vessels travel through up to your brain. These types of serious infections are most often complications due to infections in the central face around the nose, for example, or the paranasal sinuses. So really bad sinusitis in this area has the potential to cause this type of complication. Many years ago, it used to be that if you got this type of infection, 100% you were going to die. However, thanks to the advent of modern, sophisticated antibiotics, there's only a 30% chance that you die, and if caught early enough, then you can survive. But it's not anything anybody wants to go through. Most infections of the central face that could lead to this are what are known as furuncles, which are a fancy term for boils. Boil is an infection of the hair follicle, so not actually acne. Acne is different from a furuncle. Acne is not the same thing as a boil, but to the untrained eye, a boil, a furuncle can look like a pimple, and you might be tempted to pop it. You may not even care what it is. You just like popping pimples that are filled with pus. That's really like tempting to you, but this is an area where it 100% can backfire. And by backfire, I mean the staph bacteria infecting your hair follicle can make their way into the deeper layers of the skin and end up being transmitted from the bloodstream up into your brain and causing life-threatening brain infections. Infections in the triangle of death that make their way to the brain, if they're caused by a furuncle, a boil, 25% of the time, what kicked it off was popping, squeezing, or surgical manipulation of the furuncle. A furuncle, a boil, for the most part, if it happens elsewhere in the body, can be approached by something known as incision and drainage, meaning we make an incision into it and drain out the pus so that the antibiotics can make their way into that boil. But incision and drainage is not a smart option in this area, as you can imagine, due to the access those bacteria have right to your brain, essentially. Really serious infections of the upper teeth or the ear also would put you at risk for this type of serious complication. You can also develop these types of serious infections if you sustain some sort of facial trauma. Say, for example, you were in a really bad motorcycle wreck or a car accident and you had a lot of trauma to the central face, erosion, shards of glass, things like that. Yeah, that would definitely be a scenario where we would really worry about this risk, and antibiotics would be a must. Now, most cases are due to staph bacteria, Staphylococcus bacteria. 70% of cases are due to staph bacteria, but you can also develop infections caused by strep bacteria. Aside from bacteria, fungi rarely can cause this as well. Now, when I say that these posts are a bit hyperbolic, I gotta say, I don't worry that people who pop or squeeze their pimples are gonna get a serious brain infection. I really have never seen or encountered anyone who has had this type of infection from popping and squeezing acne. Now, I don't recommend popping and squeezing acne regardless of the location due to the risks of scarring and also introducing bacteria and leading to a superficial skin infection called impetigo. But it technically is possible, and if you scour the medical literature, there's actually a case report that details a patient who had had an acne breakout and then went on to develop this type of serious brain infection. Now, it's not clear from the report if the patient had true acne or if they had a furuncle that they mistook for acne, and by the time they ended up in the emergency room, it was too little too too late to figure out what it was that they had. They had already had, a serious infection. So that's not clear. But regardless, it's not a good idea to pick at your skin because you can introduce bacteria easily and get a skin infection. Most commonly, that's going to be impetigo, again, related to staph bacteria, but usually it remains on the surface of the skin. People who are more at risk for this type of infection are people who have a weakened immune system and patients who have diabetes. As you can imagine, people who abuse recreational street drugs, which can be cut with any number of things, of questionable sanitation practices, if you know what I mean. Yeah, they're definitely at risk, especially, obviously inhaling these things, snorting these things. The other type of pimple, if you will, that you don't want to pick or squeeze because it's not a pimple, it's a infection of the follicle, is any kind of pus bump inside your nose. That as well. Do not pop or squeeze that. Call up your healthcare provider right away because that needs to receive special attention. I've also seen posts going around, and I think this is appropriate to warn people about, to be really careful with tweezing your nose hairs because that's another situation where you can introduce bacteria from those tweezers into your nose. And there's already a lot of bacteria in your nose. Put yourself at risk for this serious type of infection. What are some signs and symptoms that you have this worrisome type of infection where it has spread up into your brain? Well, in the majority of cases, you're going to have a really bad headache and a fever. But as it progresses, because of the way that the veins become compromised in their ability to properly drain in this area, what ends up happening is you get really prominent edema and swelling around the eyelids. Usually one eye first, and then as this progresses, both eyes. The eyes kind of bulge out as well. And because, again, that cavernous sinus where you have really important nerves traveling through, that, if you have infection, what can happen is those nerves can become impacted. So you can have all sorts of neurologic problems of the face due to infection impacting those really important nerves of your face. Not only are you going to feel unwell, but you're not really going to be your usual self. You're going to have some what we call mental status changes for sure. I mean, anytime you have an infection in the brain, that is definitely a very real possibility. I can't give you an exact number regarding the overall risk of popping a pimple in the danger zone, the triangle of death, but I will say this is something that we mostly see in people who have a furuncle, a boil on the face, like on the bridge of the nose, for example, that had been manipulated. It's not something that we typically see in people who have acne vulgaris, for example. It's just not something that routinely happens. It's possible, but it's not very common. But regardless, still not a good idea to pop or squeeze pimples. And I know what you're thinking, well, just make sure you wash your hands or sterilize whatever you're popping and squeezing things with. Yeah, if you have a furuncle, that doesn't matter because there's already an infection there. So just be really careful. And again, I don't recommend popping or squeezing, but it can be really hard to not do that. I know a lot of you guys struggle with skin picking disorder. If you do struggle with that, check out my video on skin picking disorder because I give a lot of tips and tricks in that video regarding how to stop, different ways that you can offset the urge to pick or squeeze at your skin. There is this large misconception that popping or squeezing zits, blackheads, or whatever is a way to get rid of them. And it really doesn't. It likely will damage the follicle wall and cause that inflammatory milieu to leak out into the surrounding skin. And that's why pimples tend to get all red and inflamed when you squeeze and manipulate them. And you can spread bacteria around the skin. You can get superficial skin infections. And importantly, it puts you at risk for scarring. Now, yes, it's true that extracting the contents of the pore in some cases can be helpful for accelerating the clearance of acne and getting the acne to respond best to treatments that are prescribed. But extractions alone are not really the treatment approach, and only certain lesions are amenable to extraction. So I don't recommend using an extractor on yourself, mostly because it does put you at risk for scarring. If you have a pimple and it's not in the danger zone, I also don't recommend popping or squeezing it. Things that we can do to make a pimple go away faster are to inject some steroid medicine into the pimple that can shrink it down and help help it go away much faster. And I also find that a leave-on benzoyl peroxide gel to the spot works really well actually for hastening clearance. Benzoyl peroxide is antibacterial, but it's also anti-inflammatory and chemolytic, so that can help. Or a leave-on salicylic acid can be helpful, but don't squeeze or pop acne. Anyways, guys, that's what I wanted to say for today's video. I really hope this one was informative, educational with regards to this type of serious infection, which we mostly would be concerned about if you had a boil on your face. Speaking of boils, on the end slate, I'm going to put my video all about how to get rid of a boil and why you have them. So watch that one next. But if you guys like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye!